Did you know that there is way more to pelvic health than just learning how to strengthen and relax your pelvic floor? Today, we are going to work on the upper back, and I'll tell you why. But first of all, I'm Dr. Bree, and whether you are young or old, so many of us are at risk for postural problems up here in our upper back, and it can be a really hard area to access. So let's go ahead and get right to the workout. Come down onto your side, and I'll tell you a little bit more about why this impacts our pelvic floor. So first of all, just even tiny increases in the hunchiness, the thoracic kyphosis of your upper back is actually correlated with increased risk of prolapse. So that's just one reason. This is really important to work on. So we're going to work on our upper back and also the muscles around our shoulder blades as well. So all those hard to reach areas. Bring your hands up above you, and we're going to first begin with a technique or a movement that's called Scapular Protraction. And that is the ability of your shoulder blades to go like this. So you can see my arms punching up toward the ceiling, whereas my back isn't moving off the floor. It's just my arms lifting up. And I'll show you with my hands what my shoulder blades are doing. So keep going with this movement. But my shoulder blades on my back are going like this. Whoop, and whoop. So go ahead and keep going with this. They go up and up. And we're working a really hard to access muscle, sort of hard to access muscle called the serratus anterior right now. So keep going a couple more times and just feel this sensation of your shoulder blades moving on your back. And you're going to feel this again in another move coming up. So a couple more times and feel as if you're pushing against resistance even. Exhale, always exhale with exertion. Exhale like you're pushing against resistance into the ceiling. And that will really help activate the muscles we're trying to work right now. It should also feel kind of like a little massage for your upper back. So finish up and go ahead and come onto your back with your arms out in a T and drop your knees to the right. Bring your hands to the right as well. So everything is to the right. And we're going to work on a little bit of rotation right now of the upper back. So I want you to just bring your hands together and then apart as you breathe. So opening like a book. Open and close. And for this particular movement, I like to actually inhale as I open and then exhale as I close. Keep going a couple more times. And really, whether you are, again, somebody who maybe uses a lot of technology, typing over your keyboard, or maybe you're on your phone a lot, or maybe if you're a nursing mom, or maybe if you've just noticed that your posture has changed over the years and you're a little more stooped, it's so important to gently mobilize and strengthen this upper back area. This move is particularly nice because of the way it mobilizes the back and opens the chest, which tends to be so tight. So just hang out here for a breath. You can look your head to the right, or you can look up toward the ceiling. I actually prefer to look toward the right, but I want you to inhale, puff up your chest, and then exhale, and bring that left shoulder blade down toward the floor. So it's a nice total spinal twist and chest opener. It's important when we're strengthening the upper back to actually stretch the front. All right, let's go ahead and do the same thing on the other side. So just recenter yourself, come back to midline, maybe do a little bridge, little hip lift. And then we're going to drop both knees to the left and both hands to the left. Now again, open up as you inhale and then exhale, mobilizing the spine with a real focus on that kind of upper back and then the opening of the chest right here. Breathing steadily. Again, I like to inhale as I open and then exhale as I close. I think to be even, this is about even, we'll just finish up right here If you feel like you need to do one more, go ahead and do it. But let's just stay right here for a moment. Start maybe by looking your head toward the left, and then inhale, puff up into your chest. And then as you exhale, bring that right shoulder blade down toward the floor. Look your head up toward the ceiling. Maybe you want to even look your head over toward the right, but really feel the shoulder blades down on the floor beneath you and that stretch through the front of your chest. One more nice deep breath, feeling this total spine twist, mobilizing the spine, stretching the chest, because as we work and strengthen our upper back, and mobilize it, it's also important to stretch the opposite muscle groups in the chest. All right, go ahead and look up toward the center, feet down, and just sort of take a minute to gently, never speed through these movements. Lift your pelvis up and down, and then roll to your side. And we're going to do a move on our hands and knees. So from your hands and knees in this position right here, we're going to do a motion that combines scapular protraction. Remember what we worked on earlier. So see how my arms are going to stay straight, wrists under shoulders, fingers spread wide. My arms stay straight, and I'm just going to floss kind of my shoulder blades up and down my back. I feel like this is almost like you're massaging your upper back with like kind of a towel wringing out behind you. It should feel really good, like you're scrubbing your back and your ribs clean using your shoulder blades, the inside surface of your shoulder blades. This is that protraction of your scapula. You can feel also your shoulder blades coming together, and that is retraction of your scapula. So scapular protraction and retraction. Now what I want you to do is feel the shoulder blades moving on your back as you do circles with your spine. And I'm going to show you the path of these circles. So I'm keeping my arms basically straight. And this time my spine is actually going forward and back, forward and back. And I like to think of this as like an old-fashioned steam locomotive wheel. Somehow that visual aid jogs my mind and helps me kind of get the feeling of what this should look like and feel like. Chugga, 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 chugga. Feel that sensation. Feel the scapular protraction and retraction. Protraction and retraction. As you're moving your body in a circle and the scapula, the shoulder blades, are moving together and apart. A couple more times. Again, this is just like a massage for your upper back, and it's also working and using those hard to reach muscles between and underneath your shoulder blades. Keep breathing. And let's go. Now that we have a lot of blood flow to that area, go ahead and release out your hands. Now that we have a lot of blood flow to that area of our upper back and our shoulder blades, let's come down onto our belly for our last set of moves. And if you happen to have any type of osteopenia or bone mineral density concerns, you might want to use a small pillow under your ribs, okay? This is not necessary if you don't have bone mineral density issues, but if you do, just to be on the safe side, put a pillow under your ribs. We want to avoid excess pressure on your ribs if you do have those types of problems. So let's begin working our more upper thoracic spine. So hands down, and your head is going to be on your hands. And you're just going to do little tiny lifts, keeping your feet on the ground. So no lifting of the feet. Little tiny lifts of your head. So your head in the very, very upper part of your thoracic spine. Here we go. And down. So you're keeping the elbows on the floor. They don't need to lift up. Nothing needs to lift up except your head and your neck and your shoulder area. So inhale and exhale. You're going to feel your muscles working and that more upper thoracic spine mobilizing. Let's do 3 more times. Inhaling and exhaling. Inhaling and exhaling. One more time. Inhaling and exhaling. All right, let's bring our hands out now in goalpost arms or cactus arms, like so. Again, feet are on the ground beneath you. You don't have to lift them. And let's come up more into the middle thoracic spine. So inhaling and exhaling. Inhaling, take it nice and slow. Feel your muscles in your back. And exhaling. It might be a lot. This might be like, whoa, I can really, really feel those back muscles, and that's good. These are hard to access muscles, and you can do this routine as often as once a day or, 5 days a week, something like that. If you do have postural issues, this is really going to help you. Remember, our posture absolutely impacts our pelvic health. Getting deeper into that thoracic spine. Okay, this last time I want you to inhale and then stay up here and really carefully walk your elbows in and then your hands and arms so that they're like railroad tracks parallel to one another. Your elbows are under your shoulders and you're just in a little Sphinx pose. And this is going to stretch your low back, of course, but your upper back a little bit as well. So just hold it here for a moment. Try not to let your shoulders hunch up toward your ears. You want to be nice and down your back, working the entire back. Legs are spread out behind you. Try to lift your kneecaps away from the floor, but yet keep your quads, your thigh muscles are nice and tight, keeping your feet on the floor too. So we're not lifting the feet up. One more deep breath. And relax down. Oh, so good. Okay, now bring your hands back toward the bust line. And we're going to get right down into that lower thoracic spine. So elbows back, and we lift up, 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 and come on down. Inhale, lift up, 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 and come on down. Only go as far as you can comfortably go. And down. Last 2 times. Let's do 2 more times. So inhale and exhale. This should feel for me, it feels so good because I'm really tight through my mid-back. So I just love the way this feels. All right. You should have felt that a little bit in your triceps as well. So bonus right there, working that underarm area. And if you want one little bonus move, speaking of bonuses, let's go ahead and work our booty for one little exercise here since we're down on the floor anyway. Straighten the legs out behind you. Lift using your butt muscles. Strong, strong, strong. Turn your toes out just a little bit and tap your heels together. Firing up the center line. Fire it up, fire it up. And if you are comfortable here, if this feels okay, let's bring it back into that mid-back, that upper back area, and bring the arms out to the side and then lift them up off the floor. So 10, 9, 8, squeeze the shoulder blades together. 4, 3, 2, 1, and down. Whew, so good. All right, let's go ahead and end with a quick little puppy pose or child's pose. Great way to stretch things out. So tuck your toes behind you, come up, and if you like child's pose, you can go right into that. If you like puppy pose, go ahead and start on your hands and knees. Keep your hips right over your knees and just walk your hands forward. For even a deeper upper back stretch, you can bring your hands up like so. Breathe deeply. And if you go ahead and stay right here, stay right there, stay right there, stay there, don't move. I just want to tell you that if you want more of this information about posture and how other things beyond just strengthening and relaxing your pelvic floor can help you, if you have prolapse issues, if you have bladder leakage, etc., then please check out my Lift program. It's really a holistic program that's designed to help you understand how everything is connected, especially things relating to your lifestyle, such as posture. Thank you so much for watching. Stay in that puppy pose or child's pose as long as you want. And until next time, remember, eat clean, move every day, and you will shine brighter. I'll see you next time.